My name is Dr. Chandrakant Patil, MBBS MD General Medicine, consulting physician at Patil Hospital, Singapore. So today we are discussing a healthy diet for healthy heart. Uh, so in today's session we will discuss about the role of healthy diet to maintain a healthy heart. So normally a healthy person blood pressure rises and falls throughout the day. Uh, a persistent rise in blood pressure more than the normal level, which causes end organ damage like heart and kidney. So, normal variation of the blood pressure above than the normal is usually called as an hypertension. So, hypertension has no warning signs and symptoms, and many people do not know whether they have a higher blood pressure or not. So, this is frequently known as a silent killer. So, high blood pressure increase throughout the day, which causes several cardiovascular risks and cardiovascular risk like heart attack, heart failure, arrhythmias, and stroke. So hypertension has cardiovascular risks are one of the most common cause of for the death in the world. Nowadays, number of safe and effective medicines are available to maintain to treat hypertension. But let me tell you that lifestyle modifications like exercise and dietary modifications as equally effective as medicines and can also help a person to lower the high blood pressure and preventing the progression to an heart disease. Hence, certain dietary approaches like DASH, uh, dietary approach to stop hypertension and Mediterranean diet have been engineered to reduce the high blood pressure. So one by one, we'll discuss like this. First one is reducing salt intake and sodium, uh, high sodium diet, which known to increase the blood pressure. Like packaged and processed foods are the main source of a salt in a diet. The human body requires a smaller amount of sodium in a diet, approximately about less than 1.5 gram per day, and most people consumes more sodium than they need, more than 3 grams per day. In fact, the less sodium you eat, the blood pressure you might have to lower the sodium intake. One can stop like using a food diet to keep track salt in food eat, and you increasing the intake of salt-free foods such as seasonal foods, uh, aiming to less than 2,300 milligrams each day, reading the nutritional facts label on every food package, avoiding the food that have a 20% or more daily value of sodium, avoid canned food, processed food, and junk foods. The second one is the limiting alcohol intake. Alcohol is one of the major cause for the cardiac cases. So, drinking excessive amount of alcohol increase the risk of a developing heart disease. People who consumes more than 2 drinks per day have an increased risk of heart complications as compared to non-drinkers. Third one is a cutting down number of teas and coffees. Having more than 2 cups of coffees or teas, which also increase the risk of a cardiac related complications. And fourth one is an eating more fibers, fruits and vegetables. Of course, on the other hand, potassium, magnesium, and fibers may also control the blood pressure. Fruits and vegetables are higher in potassium, magnesium, and fiber, and low in sodium. So many breakfast cereals are excellent source of a dietary fibers. Sticks to the whole foods and juices, which also lessen the heart-related complications. Combining these dietary changes with a proper diet plan and significantly reduce the one's rise in the blood pressure and prevents the heart disease. Uh, let's see what a DASH diet is. DASH stands for the already told dietary approach to stop and hypertension. It is a diet designed to combat high blood pressure and reduce the risk of heart disease. It emphasizes the right portion of size, variety of the foods and nutrients. Basically, it is an eating plan which is rich in fruits, vegetables, and whole grains, fish, poultry, nuts, ligaments, and low fat dairy. It does not require any special or pre-planned meals. Rather, it has many standard foods one may already have their in home. So diet includes uh, more of the foods that are naturally low in salt, cholesterol, and saturated fat, and foods are high in potassium, calcium, magnesium, and fiber. Dash carbohydrates, desserts, sweetened beverages, fats, red meats, and processed meals. A typical serving guide for a patient following a daily and weekly DASH diet and goes for a 2000 calorie a day can be a grains which contains 7 to 8 servings a day, lean meats, poultry, fish, 2 to 3 servings a day, and vegetables 4 to 5 servings, uh, and fruits 4 to 5 per daily servings, low fat free dairy products 2 to 3 servings a day, total sodium intake less than 2300 milligrams, usually 1500 milligrams sodium lower the blood pressure even further than the less than 2000 milligram sodium daily. And nuts, seeds, dry beans 4 to 5 servings a week, sweets 5 or less servings a week. This all this was all about servings of a dash diet. Moving on the Mediterranean diet, it has a many similarities with the dash dietary pattern, but it is generally higher in a fat, primarily monounsaturated fat from olive oil, nuts, seeds, and commonly close to 40% of a daily energy. Next, we'll talk over how these healthy diet plans can improve the health, heart health in patient having a cardiovascular. Diet encourages the intake of a food that is rich in a potassium, magnesium, calcium, help in reduction in a diet less than a 1500 gram per day. The DASH diet generally includes about 2000 calories a day. Due to avoidance of fat-rich food, it reduces the triglyceride level, improves the HDL, improves the HDL, good cholesterol, and also reduce the LDL level, bad that is bad cholesterol. Hence, can work as a successful tool in weight management. Indirectly helps to lower the blood pressure. Diet diet plans mm, can include diet plans that contains sweets, sugars containing beverages. Lesser amount of these contents like sweets, sugars, which lowers the risk of development of a diabetes and other heart-related uh, diseases. Improve the health of patient with heart failure. The healthy diet eating plan is just one key part of an heart healthy lifestyle, and combining it with other lifestyle changes such as a physical activity can help you to more control on blood pressure and LDL cholesterol for healthy heart. Accompanying the healthy diet, a person should also get at least 30 minutes of moderately intense exercise at most of the day a week. Examples includes the brisk walking and riding a bike. A person can get at least 2 hours and 30 minutes of exercise per week. So at this time, I would like to suggest some idea that can help you make healthy changes. Don't be discouraged if following diet is difficult. At first, start with the small, averageable goals. Try making one or two changes at the time until you can do it all. Learn to read labels. So by knowing serving size, you will get to know how much sodium you are getting as per serving. Use spices and herbs to flavor your food instead of salt. Choose fewer processed foods like frozen meals, canned soups, packaged mixes, etc. These contain more sodium. Look for a food that say no salt added or sodium free and low sodium. Avoid fried foods, grill, steam, roast, poach your food instead. Slow down when you eat, exercise simultaneously. Lastly, the bottom line in is a diet play a crucial role not only in developing but also in controlling the progression of a heart disease. I advise all patients to adopt a healthy lifestyle, which plays an important role in not only in treating heart complication but also preventing it. So, from this, I conclude my topic: a healthy diet for a healthy heart. Thank you very much for giving this opportunity to talk, and thank you once again.